Good afternoon, everyone. Thanks a million, Marina, for your kind introduction. Well, first of all, let me say that I'm delighted to be here. Actually, my dad originates not far from here. He's from Drama, so my ancestors are not too far. I myself am based in Brussels, where the secretariat of my organization is. What I'd like to do with my presentation is I'll say a few words about who we are, what we're trying to achieve, why it makes sense to support carers, the needs of carers, and the opportunities and sometimes challenges that exist in the European policy agenda to make progress on that field. So the network, as I said, is based in Brussels, but we have member organizations in pretty much all of the EU member states. Even beyond that, actually, we have members in Switzerland and Norway. We have good links with the American organization, the Canadian organization, with New Zealand and others. So it is not only a European movement, it is a global movement which we are trying to generate. When it comes to Eurocarers itself, currently the organization brings together 67 organizations from 25 European countries. Half of these organizations work directly with carers. Either they study carers and they provide direct services, information, training, counseling, but they do also some lobbying to try and improve the policy agenda. Some others specialize in research, so we have a lot of universities in the network. And in Greece, we have two organizations, or three organizations actually. One of them is obviously the Greek Alzheimer Association. So I'm delighted to be here and contribute to this conference. The other one which I would like to mention, is based in Athens. It's a recently established organization of carers, so trying to improve, again, the policy environment for carers in Greece. And I was in Athens actually earlier this week to attend one of their events and projects to support that. One of our missions is really to try and make sure national decision makers, ministries, pay more attention to carers and put in place the legislation required to do that. The first key message I'd like to convey is there is no standard definition or official definition of what informal care actually is. From one country to the other, you will see variations. The bottom line from our perspective is ultimately we're always speaking about the same people, and so it's just a question of trying, again, to ensure that policymakers get their act together and understand the need to capture the needs of all of these people. The definition we use, which is now more and more used, certainly by the institutions, is any person who provides, usually unpaid, and I'll explain that in a second, care, long-term care to someone with a chronic disease, a disability, or any other long-lasting care needs outside of a professional context. So we're basically speaking about families, but also sometimes friends and neighbors in rural areas, and it's probably the case in Greece. I'm thinking about the islands, or Now I'm saying usually unpaid, because in some countries, carers will have access to allowances. So small amounts, usually paid by the local authorities, not so much to pay them for their caregiving activities, but to recognize that they are carers, and so to kind of thank them. Our role, obviously, based on the nature of the network I depicted, so research and practice, is from Brussels and throughout the network, is to inform the policy making process in all fields that are relevant to care and carers, to make sure the needs and preferences of carers are taken into account. So in 2014, the Secretariat actually signed an agreement, a partnership agreement with the European Commission, which basically means the Commission gives us some money to exist, to be there, and to have dialogues with them, to inform them, and to make sure we consult our member organizations on a regular basis on topics that are of relevance for the policymaking process, and to bring the perspective of carers. So we signed the agreement with the Directorate General in charge of Employment, Social Affairs, and Social Inclusion. The main reason is informal care, and again, I will show that later on, has a huge impact on carers' ability to access employment, and particularly, of course, for women who form a majority of the group of informal carers in Europe. When you're a carer, usually you have to either decrease your time on the labor market or just get out of the labor market altogether to care for someone. And this is a problem for the EU objectives of employment and economic growth. And so this is one of the reasons why the Commission decided to sign this agreement with us. In addition to that, as you very well know, one of the key challenges facing Europe is demographic aging. And as a result of that, we see a growing demand for care. We see, parallel to that, a declining supply, shortages in terms of care professionals, GPs, so general practitioners in some countries, nurses, physiotherapists, pharmacists, and so on. The share of people who are on the labor market because of aging and who actually pay through taxation for the social protection services compared to the number of people who benefit from the social services is also imbalanced now, or getting imbalanced. And so the sustainability of social protection systems is in danger. And all of this puts more and more pressure on families, because then if you don't have access to social protection services, who takes care of, you know, the people in need? Well, it is families. So it is a vicious circle. Now, I'm in Greece. I don't have to tell you about the fact that obviously in 2008, everything got even worse as a result of the crisis and austerity measures. And this is the context we're in. This is the context for our policy dialogues with the Commission. What do we know about the situation of carers in Europe? Now, everything I'm going to mention now is actually based on research either performed thanks to EU funding or by EU institutions themselves. So it's nothing that, my point is, it's nothing that the EU institutions, the Commission, the Parliament, or your ministries would be able to challenge, right? Well, first of all, based on the definition I mentioned, the definition we use, there would be at least 100 million people with caregiving responsibilities in Europe today. Now, that's 20% of the EU population. We have election in May. As I was telling colleagues in Athens earlier, this is a big group of voters, right? So we're also trying to use that to tell decision makers, you have to listen, because these people ultimately, you know, have a strong voice, and you should pay attention to what they need. We also know that a typical carer in Europe, unsurprisingly, is a woman, usually between 45 and 75. So a lot of these women, as I indicated before, face real issues when it comes to maintaining an active professional life and combining work and care. And that, again, affects the economy. And we also know that currently 80% of long-term care in Europe is actually provided by families, friends, and neighbors, which is incredible. Now, this is my last figure, I promise. The economic value of that, because obviously it's all good to say carers need justice. But I mean, these days, again, as you well know, politicians, they need to speak about economic, value and so on, the economic impact. Depending on the member state, the assessed value of informal care is between 50 to 90% of the formal long-term care budget. And a report published by the Commission earlier, I was going to say this year, but actually it's at the end of last year, says that if we were to try and replace informal carers by professional carers, we would have to increase the share of GDP on average for the EU by 130%. So concretely, what this means is there's no way around carers. There's no way around them. If we were to get rid of carers or try and replace them, our system would collapse, okay? And it's already difficult as it is to meet the growing needs of an aging population. So there's a big momentum around care and caring and about what needs to be done to support carers. So I suppose this is pretty good for our movement because then we see more and more decision makers listening now, to what we have to say. I tried to include in my presentation some data about Greece, just to give you an idea of what we know about Greece, because this is the most relevant for you. Now, Greece is at the extreme, you're right. This is the self-reported. This is carried out by an EU agency called Eurofound, based on surveys. This is the share of self-reported carers in member states. Now, Greece comes first with 34% of people who responded to the survey reporting caregiving responsibilities, okay? Now, this is not surprising because, again, you know better than I do that the long-term care system in Greece is a bit what we would call familialistic. So depends a lot on families. Public services, the provision of public care services is fairly limited. And that, again, poses a lot of challenges for families and, again, particularly women. This is the same graph, the same data, but per gender and per age strand. And there you see Greece in red, 34% as I said, mainly women, 10% more women than men. And it's well spread, across the age compared to what I told you before. Now, the 18 to 34 compared to the average EU, which is between usually 45 and 75, is also based on what I've collected, explained by the crisis and the fact that a lot of young people who find themselves unemployed are at home and then play a role in caregiving responsibilities. This is on average what it actually means for Europe. So you can compare. So you see that compared to what I just showed you for Greece, where it was well spread, usually it's mainly between 50 and 65 plus that you see the majority of carers, with, again, women playing the most prominent part in the provision of caregiving. We also know a lot about the negative impact. There is, I should mention, some positive impact of caregiving, but there's a lot of negative impact of informal care on carers themselves when not adequately supported. The first one, as already hinted, is the ability to maintain an active professional life and to remain on the labor market, if not full-time, at least part-time. But again, we see a lot of people dropping out of the labor market, and then you are a carer for a few years and then try and go back. It's extremely difficult. It is also extremely difficult, we have data about that, when you move from full-time to part-time to try and go back to full-time afterwards. You are usually stuck in either part-time or just an employment. Now, as a result of that, obviously, a huge impact on social exclusion and poverty. 1 in 3 informal carer, for example, in the UK, is in debt. not only because they don't have access to a full-time job, but also because they tend to chip in, they tend to contribute financially to the care costs and transportation, energy bills, and so on and so forth. So this kind of solidarity, which at first is great, I mean, should be supported, this is extremely laudable, it creates a vicious circle and a trap for carers. And then we have also data showing the negative impact of informal care on the health and well-being of carers. Again, just to give you one example, the prevalence of mental health issues among non-working carers, so they have a very limited social life usually, is 20% higher than among non-carers. So again, it's a vicious circle because those people, they feel isolated, they feel depressed, they go on depression and so on, and so they become patients themselves, you know? So it increases the costs. This is the most recent data, again, just confirming what I just said, again, compiled by the European agency called Eurofound. They're based in Dublin, and they specialize on data regarding the living and working conditions of Europeans. All of this is online, and it is even possible, I think, that you will be able to find some specific data about Greece. Now, this is a conference about Alzheimer's and dementia. All of the negative impact I mentioned, goes for all of the diseases, and disabilities and conditions. But we also have data showing that when it comes to dementia and Alzheimer's, the intensity of the care provided is so high that, there's a correlation between the intensity of the care provided and the intensity of the negative impact on the carers. So the negative impact, what I'm saying, the negative impact of dementia carers is particularly high, because of anxiety, because of irritability, because of lability, because of 9-time behavioral problems, which is listed as the most problematic issue for many dementia carers. So this is particularly relevant and particularly problematic for dementia carers. So what is it that carers want to meet their needs and preferences? Well, actually, in 2011, the Commission itself launched a survey among carers to try and list by order of importance what is it that should be done by policymakers to address their needs. Well, again, unsurprisingly, the first, the one on the top of the list is access to financial support because of all of the issues I just mentioned. I mentioned that in some countries, I'm thinking, for example, the Nordic countries or Ireland or UK, carers will have access to a carer's allowance, which usually is a fairly small amount, which does not cover the opportunity cost of them leaving the labor market. It gives them some sort of a token of appreciation in a way, or recognition that they are a carer and that the authorities recognize that. Why is it that the amounts are so low? Because what we see as well is that a lot of policymakers have this, what we think, naive thinking that if you start supporting financially carers, well, people will drop out of the labor market and choose to be carers and remain at home. Of course, because this is a super nice status, we all want to remain at home. And so this is the reason why whenever, and even if there's access to a carer allowance, usually the amount is really slow, because ultimately public authorities want carers to remain paid carers for only a limited amount of time and then go back to work. Access to flexible working conditions, just the ability to, from time to time take a break or work from home or leave earlier and then work longer the next day, Now, in fairness, some companies do that proactively, but it's usually huge companies, multinational companies, because it's easier for them to kind of organize that or cope with the flexibility of their employees. But for SMEs, what we see, it's not that it's more difficult. I run an SME myself. You know, it's like a small family. We always try and find a way to, you know, cope with each other's responsibility. But it's just there's not this proactive way of addressing the needs of potentially employees with caregiving responsibilities unless there's a legal environment in place. And so carers are recognizing this and are calling for a legal environment. We've made some progress on that front in the last few months and years, and I'll speak about that in a minute. Pension credits for care time. This is particularly important for women because when you're out of the labor market or you have to reduce your working time, not only do you have a lower salary, but your pension is also lower. That explains also the gender pension gap. And so when, you know, if you take into consideration the figures I gave you about the economic value, right? And the fact that if you were to replace the informal care by professional care, it would be probably super expensive. You know, carers are saying, what about recognizing our contribution, because it is ultimately a contribution to care systems and society as a whole, through pension credits. So just take into consideration in the calculation of my pension rights, the amount of time I spent at home caring for my mom or my dad who suffers from or suffered from dementia. You know, I did that for 5 years, that should be recognized. Regular breaks from caring. A lot of carers provide care 24/7, and then they collapse. Again, this is not sustainable. It turns into a vicious circle, and these people should have access to just a weekend from time to time, or just an evening to go to the cinema and meet some friends, like, you know. So respite care, the ability to rely on professional carers to come over to your place for just a few hours or a couple of days, is extremely important. Now, again, this exists in some countries, but needs to be improved. And we have practical examples, such as in Scotland, which is one of the most advanced regions you can think of in terms of carer-friendly environments. There was a woman who was taking care for her husband, and he needed regular dialysis. And then at some point she was about to collapse, and then she was looking for an option, an alternative option, to take a week off, and she approached a daycare center. And the nurses there told her they didn't have the license to perform dialysis while they're professional carers. She was doing that herself at home, and she's not a professional carer. So just because the legal environment was not in place, she was actually not able to rely on professional carers to take over for a limited duration. I have another example, which is a Greek one. Recently, project meeting, I'm in London, I meet a Greek professor who works in London. He approaches me, he says, oh, I'm a carer myself. My dad suffers from dementia, actually. And I'm like, okay, great, but then we discuss that, and then we discuss something else. I'm like, do you often go back to Greece? He says every weekend, because she's in a center during the week, but then she's released during weekends. And so I have to go back every weekend to take care of her. So this is the kind of amazing and surreal situations carers have to deal with, and this needs to stop, obviously. Now, training and access to information generally. Usually you become a carer overnight. You know, someone in your family develops the first symptoms of dementia. You go to see specialists. There you go, it is dementia. You've become a carer. No one tells you, you're a carer now. You will probably have to deal with this and that and that. So this is what you can expect. You have no access to information. You have to collect that information, usually on your own, trying to harass doctors because they have other things to do so that you can have access to it. Or Google things and then come across very frightening things. So access to basic information and training is also extremely important. So everything I just mentioned is based on EU research. I mean, we have more than enough to act. don't you think? I mean, we have the proof that this is not sustainable. We have proof that it's impossible to replace carers. We have proof that it generates a vicious circle, and so ultimately it is a time bomb. So we need to change the situation. Now, the role of my association and our member organizations at their level, national, regional, is to push for that. And I want to mention a few things that have happened in the last few months or years, which I see as positive. When we signed the agreement in 2014 with the Commission, we already at the time wanted to push for an EU strategy on carers, to encourage member states collectively with the Commission to look into the issue. Very diplomatically and informally, the Commission told us, we completely support what you're trying to achieve. This is the reason why we signed the agreement with you. But this is too early because actually at this stage, member states actually refuse to sit down together to discuss long-term care together. So before we discuss informal care, let's discuss long-term care. So they asked us to push for that with them, which we did. And we made sure to include informal care as well, of course. At the end of 2016, so a bit more than 2 years later, the Commission announced the launch of an EU pillar, the so-called EU pillar of social rights. I'm sorry for the jargon. I mean, it sounds complicated. It's actually not complicated. I mean, the Commission likes to come up with big names, but the pillar of social rights is very simple. It's a simple document which lists 20 principles regarding social rights for all EU citizens across Europe that all member states should respect and look into in terms of the policy making. This is what some social NGOs would consider as a very late attempt from the Commission after the crisis and the austerity measures to bring back the social dimension of the EU on the table. Fair enough. You look at the list, they concern access to the labor market, fair working conditions, so mainly employment, and social protection and inclusion. What's in it for us? Well, when you look closely, there are at least 10 of these principles, based on what I just told you about the situation of carers, which are of relevance in terms of policymaking. There's a topic which I did not highlight yet. I'll mention it when I speak about our research projects, but it's the topic of young carers. There's a lot of kids who are involved in caregiving. I'm talking about sometimes 7, 8 years old who provide care to someone with disability. It's just crazy. And that affects their ability to access education. So access to education, training, lifelong learning is of relevance for those young carers. Young carers should be captured in policies focusing on access to education because they suffer discrimination. Gender equality for the obvious reasons I mentioned earlier, equal opportunities, active support to employment, work-life balance, healthy access to healthy living, childcare support to children, access to minimum income, inclusion of people with disabilities, and long-term care, the future of long-term care. So many entry points there, right? So the idea with these principles is, okay, all of the member states now agreed, and the Parliament and the Commission agreed that, yes, they are willing to sit down together and look into this. Now, long-term care is part of the list now. So that means all the member states now are willing to discuss long-term care together. Work-life balance was also part of the list, and the first initiative launched by the Commission along with the proposal for the pillar relates to work-life balance for parents and carers. That started, so when they launched the pillar 2 years ago, and very quickly, Eurocarers, so my organization, and a long list of social NGOs, we started to push and lobby the Commission, the Parliament, ministries, and so on, to make sure carers would be included. To our surprise, they did include carers, which was good. And the proposal then included the provision of 5 paid days of leave per year per worker called a carer's leave, which is the first ever carer's leave at European level. Now, in some countries, some carers already get much more than this, right? But for countries like Greece, for example, you know, or I'm thinking there's a long list of countries, it's not only Greece, where there's absolutely no status whatsoever for carers. What does this mean? Well, it's much more than the 5 days, because 5, ultimately, it's not much, right? It's about defining who the carers are, identifying them, and then once they're identified and they're on the employment market, then they have access to this new right? So it looks like nothing, but it's a major step forward in terms of the development of this framework we're pushing for. Now, again, to our surprise, after 2 years of a very intense battle, because employers were completely against the idea, thinking who's going to pay for the leave, they reached a provisional agreement 2 weeks ago. So again, in principle, it should be formalized, but in principle, it's done. Your ministries, you can expect, your ministry, probably in the next few months, will have to translate that into national legislation in Greece and across Europe. So I mentioned before that some companies already do proactively without the legal environment, but mainly multinational companies do some good things, and this should also be encouraged, and we're trying to do that through some of our activities, and our members do that as well. So practical measures, once you know who among your employees have to combine work and care, you can ensure they have flexible arrangements, so the employee can feel empowered to come to the boss and say, I'm sorry, but tomorrow I have, my kid has an appointment, so, I'll leave earlier and I'll work later the day after, and, and it's fine. There's no stigma as well. There's communication within the company about that. Some payments during emergency leave. So you say, next week, my dad has, again, surgery, I need to be there for 2 days, and you don't actually, the employer will say, that's fine, go and you'll get paid. We accept that. Or just they will organize information sessions during lunch about what it means to be a carer, to inform not only the carers themselves, but the company, the managers and so on, about how to address that, so as part of the human resources policies, or just give them, again, very practical solutions, like you are entitled to use the internet during working hours or lunch hours to look for information, or you can use your professional phone to make, medical appointments and so on. So, based on the Pillar of Social Rights and the growing momentum, we, at the end of last year, reintroduced at the European Parliament, again, this idea of an EU carers strategy, okay? The pillar mentions in the work-life balance, in long-term care, in many other aspects, they do mention carers. All the research documents I used and mentioned before, they mention carers. Usually, it's one sentence or one small section saying we need to support and empower carers. We thought, this is amazing, this is great. What does it mean? What does it mean? So we thought, let's explain what it means. So we launched a strategy which is composed of 10 easy steps. Step 1 is fairly straightforward. Have a proper definition in your legislation. So define who you are trying to target. 2, develop identification mechanisms. So for example, inform your primary care staff, GPs, when they see someone accompanied by a family member, should automatically think, what about the family member? Are you the primary carer? Is it all right? Do you have access to the information you need, and so on? Then, this is the case in some countries, like the UK, for example, or Ireland. Social services will go, once the carers are identified, will go to the families and assess the needs of carers. in terms of work-life balance, in terms of health, in terms of maybe support measures that are required, including financial support. And then the whole list of measures which are listed, in what carers want, should also be put in place. Now, what we're trying to do with this, and that's already started, we will develop country profiles based on this exact same structure for each of the member states, short documents by the end of the year, to say, okay, this section definition, Greece, there's no definition, right? So one should be developed. But Greece obviously is an easy one, but because probably most of the sections would remain empty, I'm sorry, at this stage. I'm sorry to say. But in some countries, sometimes you have a definition, a good definition, but then nothing happens in the field, so that needs to change. So by the end of the year, we will have a comparative overview of what's in existence in all of the countries that will be useful for our member organizations at their level to keep pushing, but also for us at EU level and also for member organizations to compare with other countries and see, okay, we have the same definition in this country, but then in terms of the implementation, they do this, we don't. Why is it that we don't do that? Because it seems to work, So it gives additional teeth to our member organizations to make a difference. We have already started compiling information about all of the member states and all of the support measures that are available. Again, I'm repeating myself. It's only one of two slides, but I just wanted to show it to you. So that table is available on our website. Now, Greece is the third one, from the bottom. Besides access to some information and some training limited, mainly by NGOs, mainly at local level with very scarce resources, so nothing organized by public authorities, and some, let's say, support measures to carers, such in terms of taxation, for example, or access to daycare center sometimes, and we visited the daycare center in Athens earlier this week, where they have a bi-weekly group for carers. But again, that's extremely limited. It's not available across the country. So there's this postcode lottery, as we call it. So if you are in the right area of Athens where the daycare center that organizes that is, good for you. If you're not, well, too bad, there's no service for you. So this is about the policy rationale and the policy environment for our work. Some progress done, still a lot remains to be done. I would say, quite frankly, at international and European level, so we work with the WHO as well, for example, now the awareness raising, the awareness about the needs of informal carers is very, very high. I mean, we see a lot of departments in the Commission and in international organizations at least mentioning systematically carers now, which is already, great. But the challenge for us now, and this is the next step of our strategy, is to make sure that momentum actually trickles down and translates into practice and policy developments at national, regional level. Marina, how am I doing with time? Yeah, good. So now I'll move on to the second part of our activities, the second strand, which is research. So the other half of our member organizations is research institutes, universities. So we collect and generate new data also. It's not only, we don't only rely on the institutional data. And we try and identify usually the gaps in terms of the data and the practices. Because, sometimes public authorities will focus on long-term care, but then they won't focus on the nuances of the actual needs of carers. So what we did in 2015 is that we created a research working group, which brings together half of our network. So the people who are part of the group, they specialize in research. They are at the top of their expertise. And through the research working group, We look for new funding to develop new projects about care and caring. We generate synergies, so new collaborations, transnational collaborations. And we also discuss, new developments or recent developments in terms of data and practice and what still needs to be done to bridge the remaining gaps. In terms of the priorities that the group has identified, and by the way, we also, of course, use that in our lobbying work towards EU institutions and ministries. The cultural changes in health and social care systems. We speak a lot these days about integration of care, right? You've heard that expression, care integration or integrated care, the need to connect between social and health, or when you are active, actually, I used to work for the health sector. It's even a different definition. It's between primary, secondary, tertiary care. So integration of care is one of these numerous buzzwords you hear, but it's all great on paper, but the reality we face is that usually, nurses, doctors, they don't have time to speak to families because they're under pressure, or just they don't want to speak to families. And so we need to change the mindset. We need to demonstrate the added value for them, because informal carers bring a lot of added value in terms of information for the treatment and adherence to treatment as well. The legislative and policy aspects of carer situation goes without saying based on what I just told you. The value and cost of caring. We are in the process of finishing a big study about that. So I mentioned some figures. Usually the figures, they focus on how much it would cost to actually replace informal carers by professional carers, right? But what about the opportunity cost? What about the cost of people not being able to work because they're carers, and therefore, since they're not working, they don't pay taxes, they don't contribute, they don't spend money, that's also a cost for society. So we're trying to capture that in that study as well. Health and well-being, coordination of care systems, the role of new technologies. Again, we all see the emergence of a plethora of, smartphone apps about how to maintain your health, how to keep an eye on your, dad who has dementia and things like that. Again, there's a big market around that, but there's no real, it seems, coordination. There's a lot of data showing it works at macro or meso level, so it will have a positive aspect on families. But what about the system? How does it connect with the system? So this needs to be documented as well. The role of friends, neighbors, and volunteers. The legal environment, when it exists, tend to focus on families. But then we know that in rural areas and rural countries, and again I'm thinking Greece, the community as a whole plays a role. So friends, neighbors, they play a role. A few weeks ago, we were in Slovenia where we heard, I think 19% of informal care, it was neighbors and friends. So it's huge. And of course, the collection of good practices. So just quickly to give you a quick overview of the projects in which we are involved. The first topic is integration of care and what it actually means. We have two projects on that. The first one is led by an Italian organization in Bologna. The project is called Dare, which means give. And there the idea is we have a group of professionals from, I think, 5 countries, so Belgium, Romania, Italy, France, I'm probably missing Portugal. And we go and visit each other's region and visit good practices in terms of integration of care. It can be services to support carers when they exist, but it can be also services, professional services where health and social care professionals will tell us how they manage to work better together, usually in a cheap way. So without asking additional money to the public authorities, because obviously they all work under financial pressure. The second one is called Enhance, and the objective of the Enhance project is actually to look into the curriculum, professional curriculum of family and community nurses. So these nurses, they are at the forefront of care, right? So they are the ones who interact not only with the patients, but with the families as well. So they should know how to interact with carers, and they should, learn more about the needs and preferences of carers. And so as part of this project, which, by the way, does not only focus on carers, but on integration of care, we look into the existing curriculum of family and community nurses across Europe, and try and develop with a consortium of partners from across Europe to review that and make suggestions about how it could be improved. In Enhance, actually, I'm not going to list all of the partners in each of the projects, but I just wanted to show you that we have 2 Greek partners there. So the University of Thessaly and of Crete are part of the Enhance project. So I don't know, maybe that will inspire you for future either consortia or collaborations with them. All the info about these projects is available through the Eurocarers website. The second key topic, which I briefly touched upon, is the potential offered by ICT-based solutions. ICT-based solutions can be used by carers or for carers to provide them with access to information and training. I mentioned access to training. The truth is, when you're a carer, 24/7, it might be you cannot leave your home because of your caregiving responsibilities to go to a training session. So ICT solutions there can help you access training online, okay? So during, I don't know, the nap or in the evening, you can then have access to training about how to provide better care in a more comfortable environment for you. Now, Care for Them is exactly about that. It looks at ICT-based solutions, and there are a lot of websites nowadays on this new emerging market where, as part of the services provided to carers, you also have access to fora. So you can interact with other carers directly online. And usually you have a moderator who is either a social worker or a psychologist. But more and more, because of the market, those people are actually not trained at all. It's just someone attached to a company who runs the, who runs the website and the forum. So Care for Them is about developing a training for the moderators of these online platforms, so that they can a bit better understand the sensitivities of carers and the needs of carers.
Mr. Yghemonos, you have just 5 minutes.
5 minutes?
Yeah.
Perfect. Material Life is about smart textiles, so completely different. It's about smart furniture, shoes, and clothing. Not only smart, but fashionable, because there were previous iterations of the project where, they came up with very innovative products, but then ultimately no one would buy them because they were ugly. And so they're trying to improve that. And we are involved to provide the perspective of carers, because obviously it's a win-win. It's good for patients, but it's also good for carers, because if you buy your mom a nice new blouse, and thanks to that blouse, you can keep an eye on her if she falls through your smartphone. So it's good for the patient, it's good for the carer. Young carers, we have 2 projects there. Young carers are extremely important. They're completely invisible at the moment. So we're trying to change that as well with 2 projects. The first one is about preventing mental health issues among young carers. And the second one is about developing tools to empower and train educational professionals, so teachers and school professionals, to identify and support young carers and to refer them to professionals if required. So all of that is on the website. And that's it, so perfect timing. Thank you.
Thank you, Mr. Yghemonos.